Please see full important safety information at the end of this video.
Hi, I'm Dr. Lisa Masterson, and I'm an obstetrician gynecologist based in Santa Monica, California. Today, I'd like to share some ways in which you can manage and treat morning sickness. First off, I think it's important to highlight that morning sickness, also known as nausea and vomiting of pregnancy, is a real medical condition and may include symptoms such as nausea, vomiting, gagging, and retching. All of these symptoms can range from mild to severe. If you're suffering from it, early treatment is extremely important as it can prevent your symptoms from getting worse. If you delay treatment of your morning sickness, it could lead to weight loss and dehydration, which may require hospitalization. Because of this, I would encourage you to talk to your healthcare provider as soon as possible about any morning sickness symptoms you're experiencing. They will be able to suggest diet and lifestyle changes to help manage your symptoms. However, if diet and lifestyle changes don't get your symptoms under control, then you should ask your healthcare provider if Bonjesta is right for you. Bonjesta is a fast-acting, long-lasting prescription medication that is FDA-approved for the treatment of morning sickness when conservative management like diet and lifestyle changes fail. The most common side effect of Bonjesta is drowsiness. Bonjesta multi-layer extended-release tablets effectively control morning sickness around the clock. Bonjesta provides rapid relief of symptoms while its enteric-coated core provides continuous relief throughout the day and night. Dosing is simple. You take one tablet at bedtime, and then if your symptoms are still not adequately controlled, another one in the morning. But most importantly, Bonjesta was specifically developed for pregnant women. Scientific studies show that the combination of ingredients in Bonjesta effectively helps control morning sickness symptoms, and it's safe for pregnant mothers and their babies. This combination is also recommended by the American College of Obstetricians and Gynecologists as the first treatment to try when diet and lifestyle changes fail. On top of that, over 35 million women have already used the combination of ingredients in Bonjesta worldwide to treat morning sickness, and it has a safety record of over 60 years for both mother and baby. Ask your healthcare provider if Bonjesta is right for you.
Bonjesta is a prescription medicine used to treat nausea and vomiting of pregnancy in women who have not improved with change in diet or other non-medicine treatments. It is not known if Bonjesta is safe and effective in women with severe nausea and vomiting of pregnancy, a condition called hyperemesis gravidarum. Women with this condition may need to be hospitalized. Bonjesta is intended for use in pregnant women. It is not known if Bonjesta is safe and effective in children under 18 years of age. Do not take Bonjesta if you are allergic to doxylamine succinate, other ethanolamine derivative antihistamines, pyridoxine hydrochloride, or any of the ingredients in Bonjesta. Please refer to the patient information leaflet for the complete list of ingredients. Take monoamine oxidase inhibitors, MAOIs. Ask your healthcare provider or pharmacist if you are not sure if you take an MAOI, including Marplan, Nardil, Emsam, Eldepril, Zelapar, and Parnate. Before taking Bonjesta, tell your healthcare provider about all of your medical conditions, including if you have asthma, have eye problems called increased intraocular pressure or narrow-angle glaucoma, have a stomach problem called stenosing peptic ulcer or pyloroduodenal obstruction, have a bladder problem called urinary bladder neck obstruction, are breastfeeding or plan to breastfeed. Bonjesta can pass into your breast milk and may harm your baby. You should not breastfeed while using Bonjesta. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How should you take Bonjesta? Talk to your healthcare provider about how much Bonjesta to take and when to take it. Take Bonjesta every day as prescribed by your healthcare provider. Do not stop taking Bonjesta without talking to your healthcare provider first. Do not take more than 2 tablets, one in the morning and one at bedtime each day. Take Bonjesta on an empty stomach with a glass of water. Take Bonjesta tablets whole. If you take too much Bonjesta, overdose, you may have the following symptoms: restlessness, dry mouth, the pupils of your eyes become larger, dilated, sleepiness, dizziness, confusion, fast heart rate, seizures, muscle pain or weakness, urination changes, and buildup of fluid in the body. If you have these symptoms and they are severe, they may lead to death. If you take too much Bonjesta, call your Poison Control Center at 1-800-222-1222. What are the possible side effects of Bonjesta? The most common side effect of Bonjesta is drowsiness. Do not drive, operate heavy machinery, or do other activities that need your full attention unless your healthcare provider says that you may do so. Do not drink alcohol or take other CNS depressants such as cough and cold medicines, certain pain medicines, and medicines that help you sleep while you take Bonjesta. Severe drowsiness can happen or become worse, causing falls or accidents. Bonjesta may cause an incorrect positive result for urine drug screening tests for methadone, opiates, and PCP. These are not all the possible side effects of Bonjesta. Call your doctor for medical advice about side effects. Keep Bonjesta and all medicines out of the reach of children. Carefully read the storage instructions as detailed in the Bonjesta patient information leaflet. Duchesnay USA encourages you to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.